Okay, people, whether you know it or not, the body is a great communicator if we just listen. The body is also very resilient and it will figure out a way to perform when we ask it to. We can still run even if our muscles and joints aren't functioning like they're supposed to. The body uses compensating patterns to perform movement when strength and mobility are just not sufficient. Compensating patterns can form when a muscle or a group of muscles are unable to properly move a joint through a specific range of motion. Compensating patterns can also form when there is a restriction within a joint that doesn't allow the joint to move freely regardless of strength. Now, compensating patterns will only work for so long before the body breaks down. The weakest link in the body often ends up suffering the injury. The body tries to tell us that it is compensating. If we can listen to it, try to figure out what is going on and correct it, we can actually help prevent an injury and even move stronger. One of the most common examples of the body compensating is having a hamstring or even a low back pain. The glute max is the strongest extensor of the hip. Hip extension occurs when the foot is behind the body with the knee straight. The glute muscle must be firing properly in order for our hip to extend forcefully, as in the push-off phase of running. Many people have problems firing their glutes properly, which places added stress on the hamstring and the low back extensors. These muscles compensate to get the job done, often resulting in a hamstring strain, chronic hamstring tightness, or even low back pain. If a person thinks that they might be having some compensation going on, this person needs to look out for 4 signs. Number 1, chronic muscle tightness, no matter how much you stretch. If muscles have to work overtime, they're going to be tight. My earlier example described the tight hamstring as one of the most common things that I see. Most people will spend a significant amount of time stretching their hamstrings and they never make any progress because they never strengthen the weak muscles that's causing the hamstrings to be so tight. Number 2, unusual tenderness in the same muscles when you self-massage, like foam rolling. If that nasty trigger point you've been working on just keeps coming back no matter how hard or how long you massage it out, well, it's because there's some biomechanical weakness that is causing it to come back. If you eliminate that weakness, the trigger point goes away. All right. Number 3, that one muscle that always gets sore. In this symptom, this is probably the muscle that is overworking to compensate for some other area of weakness. You have to find that weakness and strengthen it. Number 4, the same recurring injury. So if you always get tendonitis, shin splints, ITB, friction syndrome, or any other type of overuse injury on the same side with the same body part, there's some underlying cause that has not been addressed. So even if you think you're doing everything correctly, you might be missing something. Take it from someone with personal experience with this. Me. You see, I was a Division I athlete, and we got everything you could get to take care of your body and rehabilitate any injury or issue. We got massages, we got stretched out, we had whirlpools, we had a physical therapy staff, anything to allow our muscles to recover. We got as much food as we needed, and we got the highest quality food available. We also received the best supplements as much as we wanted. But even though we had access to all these services and all these knowledge, after I injured my knee and I was released from physical therapy and was given the green light to go play as hard as I wanted to, my right hip became so tight and painful. Unfortunately, the sports rehab team just couldn't figure out why my hip was so tight. So instead, they just prescribed a bunch of ibuprofen for me. Now, I don't recommend that. I was able to continue playing until my career ended. Then, following my athletic career, my body started to just fall apart from all the abuse it endured while I played sports. Now I know the reason why my hip was so tight. It was because my hip was doing all the work to stabilize my leg instead of my foot or the core muscles to do it. But luckily, in 2015, I discovered a technique called muscle activation techniques. This technique is a system of assessing and strengthening the weak muscles associated with compensating patterns. This technique has allowed me to get my body functioning like it's supposed to and allowing me to enjoy my body with my family. I'm able to be active with them, and I don't have to worry about how I'll feel either during or even after the activity. This helped me so much that I changed my career to focus on providing this system to people. I want to help people go from feeling as bad as I did to feeling as good as I do now. So even if you're cross-training and stretching and getting massage treatments, you might be missing something. If you have any of the 4 symptoms that I talked about earlier, it might be a good idea to be assessed by a professional that specializes in identifying and strengthening the weak muscles causing compensating patterns. This way, you can focus spending your time strengthening the right muscles and having more time to do the things that make you happy. So if you're interested in getting help from me to assess and strengthen the weak muscles, either in person or remotely, just click the link below.